Melinda is a 27-year-old female, presents today complaining of migraine headaches. She has had headaches since age 12. They were better for a time, but are now worse again. They started to get worse after the birth of her second child, and are more frequent and more severe now. They have not been this bad since she was 15 or 16 years old. She has the headaches every 2 to 3 weeks. Each headache lasts 2 to 4 days. She reports that she often vomits with her headaches. The pain is usually throbbing on the right side in the temporal and parietal regions. Occasionally the pain will be on the left. She has been to the emergency department 3 times in the past 6 months to get a shot for the pain. She denies having a headache at this time. She denies fatigue when not having a headache, other than taking care of the children, but she thinks that is normal, because everyone is tired when they have 2 little children. She brought the children with her today, and has to stop talking frequently to correct the 18-month-old, who screams each time she's corrected. She's married with the 2 small children, 18 months and 5 years. Husband is a truck driver who is often on the road 2 to 3 nights per week. She works part-time on the weekends as a cashier at the local CVS. Review of systems. She denies nausea, vomiting, diarrhea, or constipation. She denies heartburn. She denies dizziness, weakness, double vision, blurry vision. She denies fatigue unless she has a headache. She has not gained or lost any weight. She denies depression or anxiety. Physical exam. Her height 5 feet 3 inches, weight 145 pounds, temperature 98.2, pulse 88, respirations 20, blood pressure 132/86. Her pupils are equal, round, react to light with accommodation. Her tympanic membranes are unremarkable and theirs benign, pharynx benign, no lymphadenopathy, no thyroid swelling, lungs clear to auscultation, heart regular rate and rhythm without murmur, rubber gallop. Her abdomen is soft, non-tender, positive for bowel sounds in all 4 quadrants. Test results. Her screening neurological exam is negative. Differential diagnoses include migraine headache, hypertension, and tension headache. Migraine headache being the most likely. It is 3 times more prevalent in females, peaks during the 3rd decade of life, which she is close to. Usually with a migraine headache, physical exam will be normal in between episodes, which she is with. The criteria for diagnosing migraine headaches must have at least 5 attacks, with the headache lasting 4 to 72 hours, unilateral, pulsating quality, moderate to severe pain intensity, aggravated, aggravation or causing avoidance of routine physical activity, at least one of the following: nausea or vomiting for migraine, photophobia, and phonophobia, which she does have many of these characteristics. Hypertension, looks like she's actually exhibiting signs of true hypertension. Her systolic blood pressure is between 120 and 138 millimeters of mercury. Her diastolic pressure is between 80 to 89 millimeters of mercury. With physical exam, it's usually entirely normal except for the presence of elevated blood pressure. So hypertension is also highly likely. A tension headache, recurrent headache lasting 30 minutes to 7 days, usually without nausea or vomiting, and with at least 2 of the following characteristics: pressing or tightening, mild or moderate pain intensity, bilateral, not aggravated by routine physical activity, and females are more likely affected than males. So this is the least likely diagnosis for her. Diagnostic testing. No additional investigation is needed with recurrent typical attacks with migraine headaches within the usual age of onset, family history, and normal physical exam, which she has, so no routine tests unless you're unsure of the diagnosis, then possibly have a lumbar puncture drawn. I do not believe she needs that. With tension headaches, imaging studies are only done in patients with headaches that are unexplained and abnormal, with unexplained and abnormal findings on the neurological screening exam. Now with the hypertension, I would go ahead and order a urinalysis with a microscopic evaluation, UN and creatinine, albumin, creatinine ratio, just to check for the evidence of renal disease. I would also do non-office, home, workplace, 24-hour ambulatory blood pressure checks to establish a pattern of hypertension and to actually confirm the diagnosis. Serum electrolyte levels to check for low potassium, and screening for coexisting diseases that may adversely affect this prognosis. I would do a fasting serum glucose, a serum lipid panel, uric acid, calcium, and decide on a treatment plan from there.